if they are trained properly and if they have the gender sensitization required, I mean, we have a huge resource in terms of the ASHA. There are about 7 lakh ASHAs there or maybe more. And if their training is proper, like Renu has been telling, and then perhaps a lot of things would roll out at the ground level. That's for the ground level. Then, of course, then one needs to look at the other laws, related laws, which is child marriage. I mean, the government finds it very difficult, the state finds it very difficult to intervene in the area of culture, especially in terms of child marriage. If you take a look at the kind of advertisements that are there to talk against child marriage, most of it has a very instrumental notion of the woman's body. I mean, it's all about whether the girl's body is prepared for marriage or motherhood, as if the girl herself has no agency, no autonomy of her own. There is no understanding of the woman as separate from the body. So I think there is also a need to look at agency, autonomy of the girl child in terms of whether of choice when it comes to marriage, and not seeing the body as separate. You know, when you talk about motherhood and marriage, and almost all of it is around discourses of whether the woman's body is prepared for it, right. I think then we miss the point about nutrition, about child care and education, and then child marriage, and then the whole continuum of care that is there. So I think that these are notions and ideas that one needs to look at when one is looking at this very complex picture of maternal mortality and its link with child mortality.
Absolutely. Well, now before we go ahead into the discussion, let's take a look at this report about maternal mortality.
Motherhood is one of the most significant points in a woman's life. But it is nothing less than shocking that every year 50 million women in the developing world give birth at home with no professional help whatsoever. And every year nearly 350,000 women die during pregnancy or childbirth. Almost all these deaths happen not because of untreatable complications, but because these mothers do not have access to basic healthcare services, or if available, they are of poor quality. Most of these deaths could be prevented if skilled and well-equipped healthcare workers were available to serve the poorest, hardest to reach mothers. Poorer and less educated women, and especially those living in rural areas, are far less likely to give birth in the presence of a skilled health worker than better educated women who live in wealthier households. A UNESCO report says worldwide 39 million girls are not attending school, and millions more complete only a year or two of schooling. In India, female literacy stands at a disappointing 53.67%. Women with little or no schooling lack the confidence and authority to make decisions for their own health and the health of their children. Despite progress in reducing maternal mortality, India is in the unenviable position of 73rd out of 77 middle-income countries rated by the new Save the Children report for the best place to be a mother. According to a study conducted by UNICEF, an estimated 80,000 pregnant women or new mothers die each year in India, often from preventable causes that include hemorrhage, eclampsia, sepsis and anemia. Isn't it time that maternal mortality be taken seriously? Bureau Report, Lok Sabha Television.
Well, at this point, we will definitely have to go into another break, but people do come back as there's still something coming up on the other side. Welcome back. This is Gender Discourse, and today we are talking about maternal mortality as we are trying to analyze the State of the Mothers Report 2010. Well, people, I think if we do not talk about the budgets that are allocated to the health sector, this discussion will be incomplete. So I think, Mr. Hota, I'd like to ask you here, that do you think that still a lot needs to be done in that regard? We need higher funds and we need to see that they are being utilized correctly.
Ma'am, I was saying in the interim to you that good health would cost good money.
Right.
And good maternity atmosphere would cost and should cost good money. And in my time this JSY started, and I was also worried whether the budget would explode. Okay, it has crossed 1,000 crores, so there are some questions. 1,000 crore is a big sum. But if you look at some of the Delhi motherhood issue, they are spending 1 lakh of rupees, the well-to-do, for a delivery. So 30 million into 1 lakh is some 3 lakh crores. So there is another absurdity of that nature.
Right.
My humble submission is another couple of thousand crores in a graduated, efficient manner. Efficiency is the word.
That's the word.
Then we will bring the maternal mortality somewhere around 110, 100 or something like the low hung fruit. Because this is out of incompetence, human resource availability. Nurse, you said, yes ma'am, nursing. I am very happy to say that in 10th plan the allocation was 87 crores. This 11th plan government have taken a very enlightened view. 3,000 crores is the allocation. Some will go, but some will remain available. One startling fact I want to bring to you all, and through you to the whole policymakers outside. I am not in the core policymaking group anymore. Insurance companies in this country do not allow maternity as an insurance risk. In fact, if you are pregnant, you are not allowed to insure itself till your pregnancy is completed and 3 months after pregnancy. These are the real hidden issues. Having said all this, fact is government's 20% of the money, 80% of the money is spent by people. People do spend money for life-saving situations. They do not think maternity is a life-saving situation, except the very well-to-do. So let government unhesitatingly spend a couple of thousand crores more. It's money well spent. The NRHM budget is now, the whole health budget is now somewhere around 19,000 crores, and luckily the country's economic buoyancy is continuing in spite of global situation. When I joined the ministry, it was only 6,000-7,000 crores. So there is a historic opportunity. We need not despair. Okay, advocacy groups prompting us makes us work, and even difficult states have started to recognize. Only thing is, these North Indian leaders do not see maternity yet as a political issue. It is time that instead of community getting after the petty bureaucracy, there must be a way found where the advocacy is with the political leaders. They talk of khop panchayat, this, that, all this racket. But the very basic fact of a safe maternity should become a human right issue.
Yes, would you like to react to that?
I think, yes, there has definitely been an increased health expenditure, but is it sufficient? No, I believe it is not sufficient. Moving forward, we have to look at all the issues that we raised earlier in the program. And therefore, I think if you look at the GDP spending, we're probably spending about 1.3%. This has to be doubled immediately and tripled, in fact. The MDG goals are not going to be met so easily. And I think if India is not on track, the MDGs will be lost. So I think we have a huge responsibility, and we all must share that responsibility. So I think civil society groups, and I think the doctors, the policy makers, the communities at large, everybody has to come together. But yes, health expenditure, I hope going forward in the 12th plan, we will see a considerable increase allocation for health, and more importantly, an efficient governance system and monitoring system put into place, and accountability frameworks.
Accountability, that's right. Well, Vijayalakshmi, let me again bring you here into the discussion. I think we have nearly talked about everything, but I want to now ask you that do you think that in India, somehow if we talk about the health-seeking behavior, that is somewhere lacking? People do not actually want to even exercise their rights. They think, now, as all along we've been talking, that pregnancy is something very it's manageable, and it is something that everyone has been going through it, so they don't really want to seek those kind of facilities, even the ones which the government is offering. So do you think that the health seeking behavior also somewhere needs to be questioned?